Before we get started in this video, I just wanted to apologize for the poor sound quality. It's horrible. I won't be able to redo the audio on it, but I promise that I am going to get better at the sound quality. I purchased a mic and hopefully it will get better. So hopefully you can stay tuned and watch this video and it is still able to provide some understanding of the topic at hand. Thank you.
Welcome back to a brand new episode on my channel, Mental Health with Melissa. I'm Melissa. If you're new here, please don't forget to hit that like and subscribe button for more content like this. I post new videos every single Sunday and Wednesday, as you can see here, and subscribing to my channel really helps me get mental health information out there to our communities of color and tons of free LCSW test prep. And if you're interested in my social work study with Melissa full test prep program, it is available for purchase at the link down below, where I have a full 10-week study guide with private videos available to those who purchase it, along with a complete mock exam. Okay, so we are going to be taking a look at motivational interviewing, specifically for addiction treatment. I've had some people request more information and more test prep videos on substance dependence and addiction. I have a bunch of other addiction LCSW test prep videos on my channel, so be sure to check those out. Today, though, we're going to focus around MI. So MI, or motivational interviewing, is a specific sort of therapeutic intervention that can be used in response to any sort of therapy, really. But it is primarily and commonly used in addiction. So let's go ahead and take a look at what exactly this entails. So I want to give full credit to this website here. So go here if you want to read more information about motivational interviewing, specifically addressing addiction treatment. The information that I'm going to be reading moving forward is all taken from this website. So I'm giving full credit to this website. I really like the way that they described motivational interviewing and the way in which they wrote out the information. So I'm going to be reading their information and descriptions of motivational interviewing and then breaking it down. So first and foremost, we have to define motivational interviewing. So MI was developed by Dr. Miller, a professor of psychology and psychiatry, and he first referenced this technique in an 83 issue of Behavioral Psychotherapy and has since published numerous books about it. So, based on similar principles of experimental social psychology, practitioners of MI treat motivation as an interpersonal process as opposed to a personality trait. So this means that motivation is a mindset that can be taught and encouraged. And the reason why this is a really helpful intervention to use in addiction and substance dependence is because oftentimes, if not all the time really, in addiction and in substance dependence, individuals have really started to change every aspect of their life, right? Or the addiction has changed every aspect of somebody's life because of the addiction that they're in. And so we really want to hone in and focus on being able to explore the motivation behind that mindset. So I want to get into the 4 components of MI. So engaging, focusing, evoking, and planning. So according to MI, engaging, or getting to know the client and establishing a trusting and respectful alliance, really incorporates this kind of like, I guess you could say, a Carl Rogers sort of unconditional positive regard in the initial steps in engaging, because you want your client to be able to trust you, and that's what really helps open up the dialogue, is when there's a sense of trust. And if there's a sense of non-judgment, then that's really going to help the process. So that's really what it means when they say engaging. Number 2, focusing. So coming to a shared idea about the main focus of a client's recovery. So of course, MI is usually used when somebody has acknowledge that, their life has been impacted by their addiction. And so, really understanding that, or at least assessing that they understand that, and letting them know that, you as the provider want to help them to come to that recovery or maintain that recovery. Three, evoking, bringing out the client's own arguments for change. So, of course, we all have justification to why we may do things, or why something that has been so comfortable for us, that's been like routine, is hard to change, right? And so we want to learn about that. We want to know what the client thinks about that. And then ask those open ended questions to really learn and discover more. And then planning. The client is willing to and able to envision change and how they will manifest it. So, really, this also encompasses this sort of open ended Socratic questioning, asking the client about what their vision of change is and what that looks like for them. So, that may be asking them what has worked in the past and what hasn't, or what needs to be done this time around that's different than the past. So these are all really helpful parts of MI. So now I want to look into this oars acronym. So each letter stands for a specific part and step of oars. So I'm going to read these. So O is the open questions. So the open-ended questions that I talked about, which is very important. It refers to a technique which encourages patients to become more involved in the conversation instead of asking these yes or no sorts of questions, or questions in which you ask something and the client would just respond with one-worded answers. We can ask open-ended and fact-gathering questions, and this really helps us to listen and empathize and to build a stronger relationship so that they can also be able to explain things on their perspective, so that they can let you know how through their lens they're experiencing things. A is affirming. So this involves bringing attention to a client's strengths. This is one of my favorite parts. I'm a really big proponent on the strengths-based perspective. I think that we all, as humans, have strengths. All of us do. And of course, they're all different, no matter what you consider how big or how small. We all have strengths. So we really want to reflect back to our clients how they're improving, what in our eyes looks like a really big resiliency factor, and give them that feedback, because who knows, maybe somebody that you're working with has never been given feedback about their strengths, or has never self-identified that they have strengths. And so we really want to make sure that we comment on that, and even early on. And that can be something, even if we don't know the person that well yet, the fact that they made it to the session, that's a huge strength. So even saying something like, I love that you showed up. I understand that this is a challenging time, but despite all of the challenges, you still showed up. And that's an amazing quality of strength. So that's affirming for you. R, reflecting. So this can be done in two ways: simple reflections and complex reflections. So both involve a counselor showing empathy and understanding to the client. Simple reflections are carried out by reiterating something that the client said. So this is really like when somebody says something to us, and then we say, well, it sounds like, or thank you for sharing, because from what I'm hearing you say, and then kind of repeating in a different way what they said. So you're reflecting to them that you are listening. Complex reflections entail making skillful guesses about something the client has implied, but maybe hasn't said out loud. So sometimes they can be portrayed as statements, as it shows a deeper level of understanding in regard to the counselor's patient. So questions can sometimes provoke more defensive responses. So when a therapist gives input via statements, it helps the patient see something they might not have before without potentially offending them. So I really like that, because again, you're going a step further to maybe reflect on something that the client said, but kind of like adding something to it that maybe they may have not taken away just yet, right? But it's been implied in what they're saying. And then we have, lastly, S for summarizing. So really, this is when the therapist compiles all the information and concerns about that the person has shared. And when the patient is able to consider all of this information, it can be easier for them to realize that they want to recover and get sober. Summaries are particularly effective at helping a patient realize their own change talk. Change talk is a concept usually initiated by a therapist trying to encourage a patient to change their ways and seek sobriety. However, with MI, the patient is able to initiate their own change talk, making their desire to recover even stronger. So, summarizing is really a different form of reflection, but really encompassing everything that has been talked about and shared. So, this may really be beneficial the longer that you work with the client so that rapport has been built and you can use all of this data of information that they've told you in past sessions up until the most recent session to summarize some conclusions that you're taking away and major themes and helping them understand what their change talk is. So I hope this was helpful. I really like the MI approach, especially as it relates to MI. I used to be a substance use disorder counselor, and I really loved working with that population because really folks that have gone through addiction and are in recovery, and those that are still dealing with the effects of addiction and dependence have a lot of resiliency to go through some of these really big challenges and addressing kind of the concerns even behind the addiction. So I am probably going to do a part 2 of this video with an actual LCSW test prep vignette question because I know that those are very much liked. So stay tuned for that in the next video. Thank you so much for watching. Until next time, managing mental health matters.